Hi, I'm Mark Sarles, the Senior Vice President for Academic and Student Services at Fayetteville Technical Community College. The nursing program at Fayetteville Tech has been an integral part of the institution since its beginning in 1961. 2020 is the year of the nurse, and in 2021 we will be celebrating our 60th anniversary here at the college. This past year we've been working to expand our nursing program. With the pandemic, we had an unfortunate event occur where we had to close our early childhood, but this vacant building presented a great opportunity for us to expand our nursing program to meet its capacity and meet the needs for employment in the healthcare industry in the Sand Hills region. As you may well know, the Sand Hills region is a medically underserved region. So this is a great opportunity for us to be able to grow a program that is in high demand in an area that is medically underserved.
I'm Sandy Ammons, Executive Director of FTCC Foundation, and the building located behind me is the Early Childhood Education Center, which will become the School of Nursing at FTCC. It is located on Hull Road, which is a major thoroughfare through campus, located right near the entrance at Fort Bragg Road, which is a major gateway into campus. The building is a story and a half. The second floor will be classrooms and faculty offices. The first floor will include the lobby, faculty offices, conference room spaces, simulation labs. The building is beautifully landscaped, there's tons of parking, and there's plenty of room to grow for future expansion.
I'm Dr. Murtis Worth, the Dean of Nursing at Fayetteville Technical Community College. We're standing inside the Early Childhood Center in the main lobby. This lobby will be remodeled to take out the vestibule and the offices in the front to create a large study space for students, and back behind the door will be a student lounge area with vending machines and another study area. We're so excited to be able to move into this building because it'll allow all of nursing to be housed in one area. We're currently spread in 2 different buildings on the Fayetteville Tech campus right now. All of the faculty will have offices and shared between the practical nursing programs and the ADN program on the second floor. It will mean a lot to intersperse the students in one building and to have everybody under the same roof, as our end goal is to have continuity of the students moving through the program. So if a student starts in practical nursing, we hope that they'll come back after they get their LPN license and go to the associate degree nursing program and get their registered nurse license.
There's 10%. We're running some sugar water. Okay. Now it's asking, are you sure you're using dextrose 10%?
I'm currently in the back hallway where 4 of the simulation labs will be located. The whole building is a square with a courtyard in the middle. What makes it beautiful about using it as a simulation center is that these corridors are big enough to use to move our simulated patients via stretcher or wheelchair from one area to the next, just as they would in the real world. The courtyard is a big open area that'll be great for students to be able to study, and we're also going to take the front lobby and take out some of the offices down there and open it up into a large study area and lounge for students. On the left side of the building, all of the rooms will be simulation rooms. It can be 2 very large simulation rooms or divided into 4 individual ones. Each individual lab, the 4 of them, will have a medication room, a charting area, and a supply area for the student nurses to use. On the right side of the building will be a large conference room that can be changed over into a conference table or switched into a presentation area or as a group learning area. We're inside the early childhood classroom that will be remodeled for one of the 8 simulation rooms. The cabinets that are here currently will be removed, and we will build in a storage area behind here where all the clean utility supplies will be kept just like they are in a hospital or in a long-term care center. Behind me will be 3 beds across the wall. With each bed will be monitors that are at the bedside where the nurses can look at the simulated patients' EKG tracings, blood pressure, oxygen levels, and there will also be what we call a head wall behind them that will have functioning oxygen and suction that will pipe in air so that they can see the bubbles and all the equipment work as it would inside a hospital setting. We also, over in the corner here, will take out the little reading station that the children used to use and put in there a medication dispensing system. This is important in the quality of health care because this is a big issue where they have a lot of mistakes happen, and so this will simulate an area where we do not interrupt when we're preparing medications. We will also, inside this particular room, have exam tables that will mimic the primary care setting. We're in the Health Technology Center now in one of the labs that we use for our skills training and simulation. I want to point out the differences of what we have now and what the new technology in the new building will offer. We will have our beds and our mannequins over there. We will have head walls in the new building, however, they will be functioning. These just are on the wall and nothing on them moves to give a visual cue to the students when they're working with the patients. Also behind each bed will be a monitor that will show vital signs, EKG tracings, oxygen saturation levels that we will set up as cues to the students as they work with their simulated patients so that they can decide what they need to do and what the priority interventions are. Another thing that we will have is cameras up in the ceiling and microphones so that the instructor does not have to stand right next to the student but can allow them to be in the room and working with their patients by themselves, and that this instructor can stand outside the room and talk to them, have the patient talk to them, and film the whole entire interaction with the student and the patient. The 3 debriefing rooms will be outfitted with televisions and monitors that we can then send back to that area to take the student to a private area where we'll debrief them on how they interacted with the patients. The other nice thing is that while we do have 2 rooms in our HTC building right now that are equipped with microphones and cameras, the new building will allow all 27 beds to have the microphones above them, the cameras, the filming capabilities, and so every single bed will be a simulation center bed and not just the 2 that are here.
The expansion of the nursing program and facilities where they will be housed will be a game changer for FTCC and the community. Expanding our facilities and adding much needed and upgraded technology will allow us to increase our capacity by 100 students over the first 2 years and eventually grow to a total of 400 students. Additional nurses are desperately needed in our community and by our healthcare partners. Your support for this project will help this vision become a reality and will allow us to better meet the employment needs of our community and the region.